Hello, I'm Derek Robinson. I'm a consultant orthopaedic surgeon and the head of the surgical division here at the RUH. Now, over the last 5 months, we've been pulling out all the stops in order to treat patients suffering with COVID, but also maintaining our cancer and emergency services. Now, with the COVID demand at a lower level, we have the chance to focus on the needs of all our other patients, to reduce waiting times, which we're aware have become far too long. We're now able to restore many more elective, planned treatments and surgeries. We completely understand that some people may be nervous about coming to the hospital, but we just want to reassure you that we've introduced all sorts of measures in order to protect our patients and staff, and that we hope you feel reassured and confident coming to the RUH for your appointment. One measure we've introduced is here in our pre-op assessment unit. Prior to surgery, every patient needs a health check, and prior to COVID, every patient used to have to come here to the pre-op assessment unit. Now, if it's suitable, we can do your checkup virtually whilst you're at home via an online app called My Pre-op. It can be more convenient for you, reduces the number of trips to hospital, reduces the number of patients on the site, and so helps us reduce infection. Some patients will continue to need to be seen at the RUH, and they'll be seen in consultation rooms such as this one. All precautions will be taken, and such as masks being worn in order to maintain your safety. Over the coming weeks, people who need important planned procedures, including surgery, will be scheduled for that care, with specialists prioritising those with the most urgent clinical need. Official guidelines have changed now due to our greater understanding of COVID and the lower prevalence in the population. It is vital to know that when you come in for your planned elective procedure, you do not have COVID. For all patients, we will individually assess your risk factors. If we feel that you are extremely clinically vulnerable, then we'll advise that you must self-isolate for 14 days prior to surgery and then have a COVID negative swab test 72 hours prior to the operation, and this must be negative. For other patients who have less clinical vulnerability or at low risk, we now advise that you can socially distance for 14 days and follow hand hygiene measures, then have a COVID negative swab test 72 hours pre-operation, and then just self-isolate from the 3 days from the swab until the time that you come in for surgery. For children, unless they are extremely vulnerable, we advise them to socially distance for 14 days, then have a negative swab 72 hours pre-operation, but there's no need for a period of isolation. Another step we're taking is to allocate certain wards for certain patients. Here we are outside Robin Smith ward, which has been designated a green ward. This is purely for patients pre- and post-operatively who've self-isolated for the designated period of time, either 3 or 14 days, and then had a negative swab prior to coming in for surgery. Other wards are used for emergency admissions, and they've been designated as blue wards. So, there are a lot of changes that are going on as we increase our elective and outpatient activity. Please be assured that it's safe to attend your appointment. Things may look a little different here at the RUH, but the care you receive will be just the same.